Hello, everyone, and welcome back to the Plan of Leadership podcast. I'm your host, Dr. Teranda Knight. If this is your first time here, this space is rooted in growth, truth, and transformation. We talk about leadership the way it actually shows up under pressure, under scrutiny, and often under supported. In today's episode, this is one that we cannot afford to delay. We're heading into summer. We know that summer is a time that most people see as a break. But for most of us, or those of us in higher education, leadership, and behavioral health, summer is not a pause. It's a window to reset systems, reevaluate policies, and most importantly, rebuild ourselves. Because what the data is showing us right now is clear. Leadership is not just stress. Leadership is not just burnout. Leadership is at risk. And if we do not address what's happening beneath the surface, we're going to see a significant increase in leadership mental health deterioration, substance use, coping behaviors, organizational instability, and ultimately systemic failure impacting those we serve. So today, we're going to talk about what's happening right now across higher education and behavioral health. The impact that is already having on leadership, mental health, and substance use trends. What the research is telling us about what happens next if we ignore it, and how you can use this summer as a strategic intervention period, not just a break. Because here's the truth, rooted in the plan of leadership. If you neglect the roots in the off season, you will not survive the next storm. So, let's talk about what's happening right now. The climate of leadership in 2026. And let's look at how this is grounded in some form of reality here, okay? Across higher education and behavioral health, leaders are navigating staff shortages, increased regulatory and compliance pressures, student and patient mental health crisis, financial constraints, and funding instability, political and legislative scrutiny. So across the American College Health Association since 2024, over 60% of students that are in college report overwhelming anxiety, placing direct strain on institutional systems. So at the same time, the Substance Abuse and Mental Health Service Administration, SAMHSA, as of 2023, reports rising rates of both mental health conditions and substance use disorders nationwide, particularly in high-stress workforce sectors. Now let's connect the dots. Who is responsible for managing these systems? Of course, we know leadership. And what often goes unmeasured is the emotional labor placed on leadership. So a study by Felt and all those within that study in 2022, they found that leadership roles in health-related systems experience higher burnout rates in frontline staff due to the decision fatigue, moral distress, and organizational accountability burdens. And so we see that this has been an issue for many, many years. This is not something that's new. And because it keeps going on, suggests we need more and more support around this factor. So what we're seeing is a dangerous combination. The dangerous combination is increased demand, decreased resources, elevated emotional responsibility, minimal recovery time. This is not sustainable. Well, let's take a look at the hidden impact of mental health and substance use in leadership. Now, let's talk about what is often not openly discussed. Leadership mental health is declining, and we're not talking about it. And we see it all over the faces of our leadership, from the dark eyes or the puffy eyes or the puffy face. We see the increase in cortisol levels. We are being educated on that constantly, not just in school, but also from social media and other platforms. We're hearing about the impact stress has on the body and how to identify it. So even with leadership stating, oh, I am okay, I'm doing great, I'm accomplishing X, Y, and Z, I'm getting awards, the students are graduating. Yes, that may be the case, but it's hiding many factors that are still impacting the success of so many, and not just students, but also leadership. When leadership mental health declines, coping behaviors increase. And the way people cope isn't all the same. It's different for everybody. Executives and senior leaders are less likely to seek mental health support due to stigmas. Goldman and their team did research in 2021, okay, and found this to be true. 2019, Frome did research and identified high responsibility roles correlate with increased alcohol use and prescription medication misuse as coping mechanisms. So chronic occupational stress without intervention contributes to depression, anxiety, and decision-making impairment. Let me say that again. Impaired leadership, mental health leads to impaired decision-making. Now, think about that impact in student conduct cases, crisis intervention strategies, behavioral health program funding decisions, and institutional policy enforcement. This is where my brain comes into play and is critical. Never feed the beast. The beast is the context, and the context is unchecked stress is the beast, avoidance of self-assessment is the beast, systems that reward burnout is the beast, and leadership cultures that silence vulnerability. And here's why I call it the beast. Because just because organizations provide healthcare insurance to cover particular things, it doesn't cover everything. And if the majority of your stress is coming from workplace, shouldn't your job be responsible for paying for those things that you are having to experience as a result of the job? And it shouldn't have to come with a workers' comp claim. It should come with identifying this as a factor. If the person goes out of work and it's identified to be associated with something that could come from that workplace, accountability should kick in, right? Isn't that something we hear about all the time, taking accountability? Well, the job should take accountability for the fact that they have a employee that is identifying X, Y, and Z, and they want to jump in and help and be supportive because that employee jumped in and was supportive of their organization's success. Why? Because when leaders feed the beast by ignoring themselves as well as ignoring what's going on in the system begins to rot from within itself, not just from the person's perspective. Because guess what happens? That person can leave and the still same issues are going on continuously. So yes, let's talk about what happens if we don't address this. Let's look forward, not hypothetically, but based on trends. If leadership, mental health, and substance use trends continue unchecked, we will see these factors. Higher leadership turnout or turnover. And according to the American Council on Education of 2023 report, increasing turnover among senior higher education leaders due to burnout and strain. They'll say that's not the case. They'll say, oh, that leadership individual decided to move on to something else, something greater or better, or they decided to take on another position in a different field. We come up with excuses to mask the problem because as long as we're showing that there are students graduating, there's not a problem, right? But it is a problem. It's a problem that's impacting our economic system through student loans. There is such a high amount of accountability towards the student for getting student loans, but a whole lot of excuses and policy changes to hide the fact that it happened as a result of them being told that education is the key to success. Now, policy breakdown. Impaired leadership leads to reactive, not strategic policy development. We have to look at our policies wholeheartedly. If we're still functioning off of policies that have not been changed in the last 3 years, that is a real big problem. Our policies should be changing according to how often research shows particular areas to be happening, and there should be someone in the particular higher education or behavioral health office that researches that and provides that data and information to make sure that policies stay up to date. The next thing is increased risk exposure. In behavioral health systems, this includes liability risks, compliance failures, ethical violations. All these things occur. So no matter how good the higher education or behavioral health institution may look, it could even be state-owned, state-run, and still have liability risks, compliance failures, and ethical violations. Okay? Just because it is a state institution does not mean that it is perfect, okay, or that it is doing what it's supposed to do. Many times, it is a clear factor that many things are getting overlooked. So here's the final one, cultural breakdown. Leadership burnout trickles down into workplace culture. It increased staff turnover, reduces morale, decreased quality of care, and education outcomes. And here's the long-term impact. Systems become unstable, communities lose trust, and outcomes decline. This is why this conversation is not optional. Okay? We have to talk about it. We have to address it for what it is. And it's not just about the success of the leadership, it's about the success of the institution. Many things are pushed under the rug for years until they pop out, and they have to be addressed, and most of the time it could lead to the students getting impacted. I don't know how many of you listening follow St. Augustine University in Raleigh, North Carolina, but that's a great example of how for years there's been financial based issues, and now because it wasn't addressed appropriately throughout those years, those students didn't know if their degrees were going to be worth anything. Many of them had to navigate to new colleges and universities as a result of that. So we have to think not just about leadership, but about the students and about the economy and what we're standing for, because we want to reduce risk. We don't want that risk to just be thrown off on someone else that it shouldn't even be thrown off on, when it should just be taken as an accountability factor for the higher education institution and the behavioral health organization. Let's take a look at why summer intervention season, why summer is the intervention season. Because it's important now for us to take a shift into opportunity. Summer is not downtime, it's a design time. Here's why. You've had 2 academic semesters or complete quarters, several quarters that has occurred as well. And you take the opportunity to evaluate them. Reduce operational intensity in any institution. And by designing it, opportunity to evaluate outcomes for the academic and service year. Budget planning cycles, strategic planning windows, but most importantly, it is the only time leadership can pause long enough to reflect. And reflection is where growth begins. We can go to every training, we can attend many functions socially, but none of those things matter. All you're doing is creating social groups that really don't know who you are. They met you, they know what your title is, but they don't know you as an individual. And those that you have to work with think they know you as an individual, really don't. They know what your strategy is around you maintaining your job role that you have. So here's something to think about. From the plan of leadership perspective, which is from my book, summer is root work. Okay, this is when you prune ineffective policies, renourish your leadership capacity, and reassess your environment. Because the soil is toxic, it doesn't matter how strong the plan is. Okay? And that leads us to what leaders should do right now. Let's make this actionable. First, conduct a leadership self-assessment. Ask yourself, am I operating from clarity of exhaustion? What coping habits have I normalized? And where am I avoiding necessary change? Look at those things. If you need support, I have assessment tools myself that I am testing and doing pilot-based evaluations to see the effectiveness of them and identifying core factors that leaders go through in higher education and behavioral health. The second thing is review policies through a mental health lens. So evaluate, are policies reactive or proactive? Do they support both staff and leadership well-being? And are systems trauma informed? And the next one is build structured recovery into leadership roles. Research shows recovery time is essential for cognitive performance. This means schedule mental health days, reduce summer workload, leadership peer support structures, and then most of all, normalize leadership support systems. Create systems where leaders can seek coaching, discuss mental health, address stress without stigma. That is what my services is about. Coaching, consulting that helps improve the mental health and reduce the stigma around stress. That's what it's about. It's not to provide you with their therapy or make you feel like you're in a therapy setting. But if you need that, I will refer you to that. Because the more we have involved in the process, the successful the outcome is. Now, our last bit, bringing it back to the roots. Let's ground this back into my philosophy. In the plant of leadership, we say growth is not about pushing harder, it's about growing smarter. The smarter growth requires awareness, accountability, and intervention, because ignoring the problem doesn't make you resilient. It makes you vulnerable, okay? If this episode resonated with you, I want you to do one thing this week. Pause. Not because you're tired, but because your leadership requires intention. Summer is your opportunity to reevaluate, rebuild, restore. And if you're ready to take the next step, I invite you to connect with me. Visit my website, www.virtuallyrenownedconsultingaccessllc.org. Follow me on social media. All my social media platforms can be reached through my website, and explore how we can work together to strengthen leadership systems in higher education and behavioral health. Because this is bigger than you. This is about every student, every patient, every system that depends on leadership functioning at its highest capacity. And remember, never feed the beast, never fed the beast. Okay? Work hard, stay peaceful. Feed the growth that sustains in you, because we seek to have roots of resilience. And until next time, stay rooted, stay intentional, and keep leading with purpose.